Hey guys, Coach Steven, SLG Fitness. Hey, welcome back. Today we're going to discuss some delts, anatomy, and function. So, to begin with, this is a view from behind looking at the delts. You see here on the top we have our anterior delt, our medial delt runs through the middle, and then of course our rear delts run through the rear. So, when we're looking at this, our anterior delts run this way. Our medial delts run the middle, and then our rear delts through the back. They all attach on the humerus around, if you feel around, you can feel it around there. Right on the humerus. So, what are some actions of the front delts, anterior delts? One, shoulder flexion. So shoulder flexion is this movement, this motion here, flexing your shoulder. Also, shoulder horizontal adduction, which is this pathway. Shoulder internal rotation and shoulder abduction. The medial delt, shoulder abduction, is when you're raising your arm out to the side, like this. And it also assists in some shoulder flexion, which is what the front delt does. And then lastly, the rear delt. Shoulder horizontal abduction, running back like this. It also assists in shoulder extension and shoulder external rotation. So those three make up the delt region of your shoulders and gives that capped look. So what are some tips that we can have for training our delts? Tip 1, we want to line up our arm path with the fibers that we're trying to train. So much like the clavicular fibers of the chest, the anterior delts run similar path. So when we're thinking of doing our raises, front raises, we want to be in this path here. Not out like this, like you see commonly, but up and in, converging. That's really going to hit those anterior front delts the best. If we're wanting to hit our medial side delts, it's typical for many people to come straight out to the side, which is fine, but you need some degree of internal rotation to make sure that that medial delt is on top when we're raising and opposing that force. If not, if we just come straight out to the side, it's more on the front delt. So a little internal rotation right there. And then of course the rear delts, which I love, the fully extended shoulder in the rear delt row. And also you can train it doing some horizontal abduction, which is not as efficient. Stopping short at the bottom of your side raises. So what I mean by this is when we're coming back down, we want to stop around here just before we get down all the way to our body. What this is going to do is limit the supraspinatus, which covers that first part of the side delt raise. It's going to be the most active. So when we come down and limit that, it takes it out of the equation. So now it's all medial delts. Tip 3, think about pushing out, not up, and use a slight lean forward. So when we're in our side raise, we want to think pushing out towards the wall instead of trying to come up. So think about trying to put your knuckles against the wall as they're coming up. That's how we want to do it. And also we want to have a slight lean forward. What this is going to allow is the medial delts to be on top. Just like this. So as you see from the side, if I'm standing straight up and do this side raise out to the side, my front delt is more on top. But if I come down into this slight lean forward, see how this moves my medial delt on top? That's what we want to do to target that medial delt. Tip 4, Y raises. Y raises, as I mentioned in the trap video, great movement for the lower trap. But it also gets that medial delt fully shortened. So what I mean by a Y raise is exactly what it says. We're coming up into this Y position. That's really going to target that side delt and shorten it the most. So the best movement can be with cables or dumbbells, either one. And we're starting around this area and just doing Y raises. Even if you do that with no load, you can feel that in your medial delts. It really gets those things really shortened. Tip 5, staying in the scapular plane. When I mentioned about doing side raises out to the side or doing any presses out to the side, some people do not have that range of motion to get out there. So to stay in the scapular plane is, instead of being out here 90 degrees, coming in slightly, elbows slightly forward. So when I'm pressing, I'm staying inside that scapular plane. And the same for side raises. Stay in the scapular plane, you're going to hit those fibers a little bit more efficiently. And tip 6, anterior delts are up and in. Like I said, a front raise is not just straight up like this, but it's much like in the same path as your clavicular chest fibers, up and in. So what are some mistakes I see? Going outside of your active range of motion in raises, side raises or front raises, it's going to invite the traps to do a lot more of the movement. So if I'm coming up and doing side raises all the way up here, you can feel those traps kick in. So what we want to do is get up to the position where the side delts are fully shortened and no further. If we do, it's going to be traps. Mistake 2, retracting and locking down the scapula. This is a big one in the chest pressing video I did. But fully retracting and pinning down the scapula while trying to do side raises is going to limit, even front raises, is going to limit your range of motion. So if I fully retract and depress down, lock down my scapula, and try to do a side raise, I'm stuck right there. But if I allow my scapula to just do its thing, I get way more range of motion, much safer movement. Mistake 3, incorrect setup and arm path. Discuss this a little bit, but for your front fibers, your arm path needs to be in this plane. Your side raises need to be in this kind of plane. And then your rear delts for rowing need to be not out like this for the upper back, but bring it down slightly, the neutral grip, shoulder extension in this plane. That's going to target your fibers most efficiently. And mistake 4, not assessing your degree of external rotation when it comes to pressing. What I mean is, you can come up in a normal press, people will think they need to press like this with their arms 90 degrees out. However, some people cannot get there. So how you can assess this is come up to 90 degrees and try to externally rotate that arm back. Now, if you can get all the way back here pain-free, fine. That's a good pressing position for you. That's fine. However, some people may only get to here. Now, let's see that from the side. External rotation. If somebody can only go to here, they need to be pressing in this plane. So to hit those delts, what we can do is, instead of a straight vertical bench, lay it back on an incline. That way, when they're back on the incline, they can press in this range and hit those fibers. So that's a big one, to avoid injury and just staying within your active range of motion. So there you have it, guys. Today covered up delts. Hopefully some of these tips and some of the common mistakes you guys can take away and make some corrections to your own training to hopefully hit those fibers more efficiently. If you got any questions, comment below. As always, check out slgfitness.com for more details. And as always, I appreciate you guys for hanging out and checking out another video. Got a few more coming your way, so be on the lookout. Until next time, guys. Thanks.